All right, so welcome everyone. Thank you for joining our UIC School of Public Health alumni panel. We're so happy you can make it, and a big thanks to our alums for joining us today. What we're going to do today is first start with introductions. They're going to give a little background on themselves, tell you a little bit about what they're doing, their experience at the school, and then from there we'll jump into questions. I'm going to start with kind of an initial question, and then we'll open it up to you. So again, feel free to raise your hand or add to the chat box and ask any questions you have. So with that, I'm going to turn it over to the people you're actually here to hear from. So I'll turn it over to our alums. So if each of you could just give a quick introduction and say hello, we can go from there. Cynthia, maybe you can start for us.
Good afternoon, everybody. I'm Cynthia Kleinbenai, usually known by Cindy. My position currently is Assistant Vice Chancellor and Director of Sustainability at the University at UIC. And I've been in that role for 12 years. Did you want us to go over a quick history now, or we're coming back that way?
Yeah, if you can do it now, that would be great.
Okay, so my background, my undergraduate degree is in biology, and then I shortly after that got a master's in environmental science, and it really focused on more of the public health aspects of environmental science. And I had a scattered history of work. I was actually living in Israel at that time, and worked a little bit for public health, Jerusalem's public health department, and then ended up doing more administrative roles for the remainder of my time there. And when I came to the US, I actually ended up in Champaign-Urbana and started working in the Environmental Health and Safety Office in Urbana-Champaign, and subsequently moved to Chicago after a brief hiatus in environmental consulting, came back to UIC in a similar assistant director role in environmental health and safety. So I was doing compliance. And then I started working in, studying, using my tuition waiver as an employee to work on a PhD, actually a DRPH initially, in public health and environmental and occupational health sciences. And as I went through my course of studies, I ended up focusing on sustainability, and particularly in higher education. So I had gone into the program because I lacked knowledge in industrial hygiene, which was part of my job responsibilities, but found my passion more for sustainability as I went through this. And that ultimately resulted in me getting the role that I have now. It was during the course of my studies, but I was the resident expert when the university was exploring how do we apply these concepts of environmental sustainability to our operations and our teaching and our learning. And so that gave me the opportunity to actually start the Office of Sustainability here at UIC. It was taking me through that. Today, well, some of my proud accomplishments, other than establishing this office, are developing numerous plans, the most recent being our Climate Action Implementation Plan. And that's really an actionable plan for the university in moving forward on carbon neutrality, zero waste, saving water, and being a biodiverse campus, as well as integration into our research and teaching. And then along with that, I established an internship program, which also established an undergraduate course that public health students participate in as this internship. So I feel that that's really been a great accomplishment and really keeps us in touch with the current generation and what they're interested in as well. So I'll leave it at that. You can take questions on anything you're interested in later.
Great, thank you. One of our other alums, Emily, maybe go ahead.
Sure. Thanks, Brandon. Hi, everyone. I know this is like such a surreal way to engage with your prospective new school. So it's amazing to see all of your faces, and just thank you for your interest in the School of Public Health. So I first want to give a shout out to Brandon. He is an essential part of my story and connection to the School of Public Health. So I actually don't have an undergrad degree, or I didn't even know what public health was before I started looking at the School of Public Health. I actually came And I got interested in this space mostly through the first job I had right out of undergrad. I was a communication major. I worked in marketing, but I had an internship on a nonprofit board, and the director of that board had a degree called an MPH. And I was very curious about what that was, mostly because I just loved the work that she did. She was the director of a child abuse advocacy organization. And so she kind of mentored me and talked to me about this space. And so actually I sent an email, just fielded it to the School of Public Health, thought it could be something cool and interesting. And instead of getting an email back, I got a call from Brandon. And I actually very vividly remember getting that call. I was sitting in my car in the driveway of the house I was living in at the time. And he was just so friendly and so kind and talked to me and really reassured me that you don't have to have a background in public health to care about public health. Like we just heard from the woman who spoke before me, is that it can be everything, right? And so I was particularly interested in working with children and families. And so Brandon was extremely reassuring and inclusive. And so I just want to give him a shout out to let, you know, the work that he does is so important to engage future students. And so my background, now that I'm in public health, like I said, it's mostly by way of working with children and families. When I came to the School of Public Health, I was particularly interested in the prevention of youth violence. So sought out a lot of opportunities therein, and I can definitely chat about them a little bit more later. But as I really think about my journey through public health professionally, you'll learn about the social ecological model if you haven't already. And it's a really helpful way to think about starting at the individual and then relationship and then community and societal levels. And so when I think about my journey through public health, going through school, I was also part of the dual program with social work and public health. So if that's something that someone's interested in, I'm glad to chat with you about that. But it really helped me frame and set my reference for working with people, particularly young people and their families. But the work that I do now, I'm actually a consultant at a strategy and data firm called Mission Measurement, where I work with foundations, nonprofit, and the government, thinking about how to define and better measure social impact. And so if I think about my trajectory through public health, it's really starting from the middle of that model and then going out, or in public health, what we call up the stream, right? So I'm working with large scale policymakers and foundations to think about how they can be more equitable and more strategic with the work that they're investing in the social impact space. So thanks, Brandon, for this opportunity. I'm really excited to hear questions and engage with folks. Thanks everyone for joining.
Thanks, Emily, for the shout out. I appreciate that.
Totally.
That was very nice. All right. Let's see. Oh, we have another student. One of our other alums, Durrani, maybe?
Hi, so I'm Durrani Ramanathan. My background is kind of interesting. So I was a biology major in undergrad. I was a pre-med student, as most biology majors are at that point. And around junior year, I kind of was in this like kind of problematic area where I was like, oh, I don't know where I kind of want to go, and is like, you know, med school the only thing. So I was kind of exploring my options. Luckily, I had a alumni at my undergrad who I kept in touch with pretty frequently, and she was also a biology major pre-med, but she ended up choosing to go into public health. She didn't go to UIC, but she kind of talked me into the world of like epidemiology and how like interesting it was, and that's kind of how I got the idea to go into my master's for public health after my undergrad program. It just sounded really interesting, the prospect of studying diseases and doing the statistical analysis. It was just like a whole new world. I didn't even know it existed until she told me about it. So I applied, got in, I graduated with my epidemiology concentration in 2013. And from there, I kind of have had a few different positions. I kind of started my journey in my career in a pure epidemiology setting, where I was working at for a diabetes research project, and it was in chronic health. It was very interesting, but then I kind of switched forces and I worked in the government sector, where I kind of did this umbrella, kind of an umbrella situation with researchers, where I kind of helped other researchers understand the data in the VA and understanding how they were like using it, the methodologies behind it, the history behind the data that was available, because there's so much data in the government. There was really nobody documenting it and trying to understand how to use it. So that was my like second role. And I recently switched over to the corporate sector. So I'm actually working for Healthcare Service Corporation as a senior analytics consultant. and where you probably know it as Blue Cross Blue Shield. That's kind of like the more known name of it. But so I work using my epidemiology knowledge, kind of doing data analytics. And what we do now is we are kind of looking at cost efficiency of providers in the Blue Cross Blue Shield network and seeing their efficiency across the 5 different states that we cover, and kind of analyzing whether those providers can improve their score, you know, what we can do to help our members in that cost efficiency aspect. And now we're including quality in that as well. So I've kind of worked in all different areas of public health, and even kind of gone beyond that into the more payer side and healthcare side of that currently. So
great, thanks, Durrani. And then last but certainly not least, George, if you can give us a little welcome and tell everyone a little bit about yourself.
Sure. Good afternoon, everyone. My name is George Smith, Jr. I'm a proud alum of the UIC School of Public Health. See? And so I graduated from the UIC School of Public Health in 1996. My journey was that when I was an undergrad, there was another pandemic, HIV/AIDS. And so I thought I wanted to be a physician, and then had friends who were in the School of Public Health. They told me about the School of Public Health. I had a chance to meet my lifelong mentor, Dr. Shafdeen Amuro, who's a professor emeritus. He encouraged me, told me to apply to the program. I applied. I did community health sciences. My concentration was health promotion, health education. Decided I wanted to go work into the community. So I've worked at faith-based organizations. I worked at several academic institutions. And presently now, I went back to school, got my doctorate degree. And presently I'm an assistant professor at Chicago State University within our Department of Public Health and Health Information Administration.
Great, thank you so much. So with that, we can jump into questions. So I'm gonna say again, everyone feel free to raise your hand or ask questions in the chat box. I'm gonna start with a kind of basic question for everyone. Why did you choose UIC, and kind of where were you at that point in your life that led you to choose UIC?
I'll go ahead and get started. It was really easy. When I started in public health, most people thought MPH were miles per hour. There were very few programs, just very few. And so had been affiliated with the University of Illinois Chicago through its urban health program, early outreach program, when I was a freshman in high school. So I've been affiliated with UIC since 1982, so I am dating myself. And so there was some familiarity with the campus, interested in the School of Public Health. I'm a Chicago native, and it just was a perfect match.
I can go next. I think, as I alluded to, thanks, George, that's so awesome. Like I said, Brandon's initial really personal outreach to me showed that the school cared about me as a person, and that they were interested in hearing about me and my story and how I could craft my narrative for my application. And selfishly, I grew up out west. I grew up in Salt Lake City, and I wanted to live in a big city. I think if you have the opportunity, if you're not in Chicago, to visit the campus, it's literally right next to downtown. But even though it's like close to downtown, it's still deeply connected to community work. And so one, it was the personal connection from the school, but also how connected the school was to the community. So like I said, I specifically came to the school with a focus on violence prevention. And at the time, they're separate from the school now, but an international organization called Cure Violence was working closely with folks in the community. And so that was something that was incredibly interesting to me. But I will say it was definitely opportunities like this to engage with alumni and current students who really made me feel part of the community before I even started. And came to Chicago 7 years ago and haven't left. So not so bad.
For me, it was a combination of things. Partially of selfish too. My family lives in the suburbs, so I didn't really want to move out of the state. I did apply to other schools, but one thing that was really great about UIC is that it is, at least back then, it was the only accredited school of public health in the state of Illinois. Yep. So that already pushed it up a little bit higher than the other programs and other schools that I was applying to. Also, it's very integrated with the other health science schools on campus itself. It's the only school in the state of Illinois that has all 6 health sciences program, like medicine, pharmacy, dentistry. So there's a lot of collaboration across researchers across public health, but also other schools. So that made it very enticing to study different things, because I was a biology major. I was very clinically based. I really want that kind of study and that kind of stuff. But I also like the fact that the alumni and just the general department, the professors are just very open, and they're very engaged with their students. The classes aren't like super large after your first few core classes, and that made it really personable. And I really liked that aspect of UIC, because you were living in a big city, you were in a really big program, but none of the classes felt overwhelming to you. So all of those factors really helped shape my decision to going to UIC. So
I'll go ahead. As I said, I mean, the main motivation, I guess, was that I had a tuition waiver as an employee, but I could have chosen another program in a state university in Illinois to get the PhD. Well, at the time I did MPH, but I actually switched to PhD. I think that I did recognize UIC's reputation, its research, and in particular, it had the program I thought I needed at the time, which was a program in that could provide industrial hygiene, chemical safety background, things like that, that I lacked in my own educational background.
Great, thank you all. So we're getting a few questions. I'll start. The first one asks, what does your typical workday look like? And then I'm gonna add to that, because I know this is kind of a timely question. How has COVID-19 impacted that in your role? Anyone can jump in.
So I'm in higher ed right now. So my typical work day would be preparing for lecture, participating in research, doing administrative work, and interaction with students. Since we've gone to COVID, I've been lecturing online, talking with my students. I understand all the students. I understand your anxiety. I completely understand what's going on. But I do have some words of encouragement. This is not the first pandemic, nor will this be the last. However, going to the UIC School of Public Health would definitely give you the skill sets, not only to help your community, but to help the nation overall.
I'm happy to jump in too. So I actually transitioned to a new role, like literally the day that the Illinois stay-at-home order went into place, but I was wrapping up my former role at the time. And so in my former role, I was at an academic research center, and of course, all data collection activities ceased, which was disheartening for sure, because you do so much work to get your study ready, to recruit folks, but for the safety, of course, of not only our staff, but for the participants that we were working with. But I'm really proud of the team that I'm still in close contact with. We redeployed our research staff to do community outreach. So they are helping deliver meals to seniors, to share resources, to shop, buy groceries for folks and deliver them if they're immunocompromised. And so it was a really innovative way to say, we're not just going to stop doing this work, we're going to redeploy our resources. And then I can shift to my current role. I mean, shout out to technology. So like I said, I transitioned right in the middle of this, and I spend many hours a day engaging with my team digitally, but the work that I do now is much more global. And so I think it's really humbling to know that this is affecting everyone in a certain way. And so I will say that, resources are being redeployed for emergency assistance, or, the expectation that community organizations are still doing work is still there, but it's not necessarily for like, you said you were going to do this program, why aren't you doing this? But it's rather, how are you helping in the local context and making sure that folks have what they need, which I think is really amazing. And foundations and, policy folks are understanding that everyone is just trying to do what they can to survive. And there's been a lot of flexibility and also just humanity and humility around that work. So the work still continues. It just looks a little bit different now.
I can jump in. I'm also at a university, but my role is a little different from George's. It's more administrative. I have a staff that I'm managing, and I manage a lot of projects. So normally I'd be in meetings or convening. Sometimes I convene stakeholders for different reasons. I do work again with interns the program I established is really run by one of my staff now, but I'll usually have one or two undergraduate interns. I may have a graduate student that is working on projects for me as well. And the projects range from sort of analytical. Right now I'm running an analysis of the campus grounds in order to make sure they're getting enough funding. It evolved because we wanted to get more funding for our tree care. We're a tree campus USA, and we wanted to ensure that our trees would be continually cared for as they need to be so they don't die from disease or anything like that. If they don't get enough water or nutrients, they are more, just like people, more susceptible. And somehow it morphed into this huge project involving GIS, which I don't have the skill sets for. It would be probably good to have them, but I had a graduate student who could map everything and trying to do some budgeting for that. So that's like the most far off thing I've done in a while. I'm overseeing, right now we have a request for proposals out to campus for, out to the vendors for putting renewable energy on campus, solar energy. So I'm reviewing those along with a team of other people, but I've been kind of guiding that process to make sure that it gets done, although it sits in a different part of the organization. Of course, all of that is being done remotely now. We do have one staff person who's been going to campus because we have a program that started through our internship program, which is food recovery in the hospital. And that we looked at it as waste reduction, but it's also community resilience. And it continues to go to Franciscan House Shelter in Chicago. It serves the patients that we serve as a hospital. So any extra food coming out of the dining hall is collected twice a week. We have a little electric vehicle that is driven there. Typically, this is handled either by student employees or volunteers, but without having students on campus, our staff, and they asked particularly that the staff that was doing it was over 60, so they really didn't want that person to go into the hospital if not necessary. So one of my younger staff has taken over. It's been a great opportunity for her, and I think overall. And she also appreciates being able to work in the office twice a week because she has a small child at home, which her husband looks after. So it's worked out for all of us, and we are really proud that we've been able to continue that program when it's needed most.
For myself, luckily, we were already kind of set up to, most of us in my company were already set up to work from home. We are all mostly laptop based. So working from home was just it was more like the network and the server problems more than anything else. But work-wise, much didn't change. Just the lines between workday and private life is blurring more and more now for me. We have a lot of meetings, a lot of deliverables right now. So my days are pretty heavy. But with the actual like COVID situation, you know, we're a healthcare company, so it's a little different for us. But I know we've been doing a lot of different things. We work with a data science team who's been kind of like tracking certain telecommunication spikes, because now there's more modifiers and diagnostic codes that you can do telehealth with because of the COVID situation. So we've been kind of tracking that, a lot of utilization in healthcare services, tracking the utilization drop, and whether like office visits, certain you know, how certain surgeries were put on hold that weren't emergent, things like that. We're trying to just track the effect of what COVID has done to healthcare utilization, but also the claims that have to do with COVID as well, the drugs and other things that have been taking place, surges in pharmaceutical claims as well. So things like that have been very interesting. We're kind of in the beginning stages of setting those studies and those like analyses up. So in the next few weeks and months, we'd have more to share with people on that.
Great, thank you all. Questions are flowing in. We have plenty of time, so I'm going to try and get to all of them. So I'm just going to keep working my way down. Emily, a couple directly for you, kind of back to back. So first, how did the social work program, doing the MSW MPH, how did that impact your school and then work? And then the second part of that is student interested in program evaluation, impact measurement, what courses helped you with that, and how has your role been different than you expected?
Yeah, for sure. So I actually wrote down some specific courses for the student that asked about program evaluation. So research methods for sure. So also the school has shifted a little bit. So I'm going to name the classes that were what they were called when I was a student, but the core competencies of what you'll get from these classes, of course, still exist. So of course, research methods, just understanding foundations of types of research, the difference between qualitative and quantitative, what types of questions you can ask with which approach, you know, those types of things. Also, a class I really enjoyed, I was a community health science major at SPH, so I really loved health behavior and health promotion. It was 480, I don't know the number now. But really thinking about what are the models that drive health and behavior decision making. That was a helpful way to think about not only models, but theories too. Community health assessment, I think it was 431, I can't remember the class, but essentially we were given the task of doing a community health needs assessment in one of the 77 community areas in Chicago. So it was really helpful to see theory from the classroom apply to the community. And then finally, as I was in the dual program, and this alludes to the next question, you have to take a research elective, the final year of your social work program. And so I took qualitative, which was really helpful because it overlapped with my MPH thesis, which was a qualitative, I did primary data collection and it was a qualitative project. And so I was able, and to the extent that you can, I would encourage folks to think about the ways in which your coursework can be immediately applicable to your internships or to your capstone project. So I specifically did a qualitative research elective for that. So then when I think about my education as it relates to how social work and public health kind of merged together, the program at the time was growing. And so I actually came into the program like specifically for public health, but social work is definitely something that I've always been interested in. I really enjoy working with people. Of course, that's public health too, but the way I think about it in my mind is that public health gave me like the macro level or like the frame with which to operate. So we think about public health as the decrease in risk factors and the promotion of protective factors, right? So it's a helpful way to think about the work. And then for social work, for me, it gave me like very micro, clinical, tangible skills. So I was a community health science major at the School of Public Health, but I was a mental health major at Jane Addams. And so the programs very much overlap, but I specifically chose mental health at Jane Addams because I really wanted to learn and be trained in clinical interventions. So I also appreciate the duality and the diversity of that. Like if I wanted to, I could go become a clinical social worker, but I can also bring both of those skills into the work that I do now. So I will say that like public health is like more macro and social work was more micro, but I think the programs, there's really natural synergies in them depending on the route that you choose. And then also the opportunities that I had as a social work student, you have to do full year-long internships. And I was really fortunate that one of my internships ultimately became my first job out of the School of Public Health, or after I graduated. So I was able to leverage the experience at an internship that became my job afterwards. So.
Great, thanks, Emily. Next question for Durrani, and I think this relates to your previous role. What was it like working with the VA and working in government and public health field?
It was really good. I actually appreciated the government sector a lot more after I worked there. And, you know, from the outside, you don't really understand the data or the way it's collected. Because one of the things that in epidemiology is like, especially in the school level, what you understand is it comes from very small like data sets or like, you know, you're collecting your own research. And that's one aspect of it. But when I went to VA and I was thrown the entire like electronic health record system at me and was like, oh yeah, describe different aspects of it, you'll really learn how to kind of understand your data and where it's coming from. Because it would be great in my first job, like we collected our own data so we could describe it, we could make sure that it was clean, everything. But a lot of the times in your jobs, and especially if you go into more data related jobs after your epidemiology degree, you're not going to get a clean data set. You're not going to know where the data was collected, how it was collected, if it was self-answered. Those are things that you learn to be very critical about when you start working with data that's not yours. And that's something that the VA gave me. And I really enjoyed it because we were given like it's as close to big data as you were going to get. And for somebody who really liked the intersection between health data and public health, it was a nice it was a good 3 years. Like I would probably say that that was my foundation in documentation and this is something that's so important when you're in the real world, and they don't concentrate on that enough in the classroom settings because you don't have time to see real world problems being thrown at you. But understanding that context and how data is collected, how you need to describe it properly, that was very important. And that was the biggest lesson I took away from the VA, and the important work that they do. There's a lot of good research that comes out of the VA that's very innovative, that doesn't always get recognized. So seeing the inner world of how the government is putting money towards those types of initiatives was also very important to realize too.
Great, thank you. And leads to the next question, which, Johnny, you can start this one because I want to ask specifically for EPI students, but it goes for everyone. And I think all of you can chime in somewhat with, how would you recommend setting yourself up for success coming into the program?
You see, I don't know exactly how to answer that question because I didn't do anything in particular. I had absolutely no idea what epidemiology was. I knew the basic definition. I described a few things, got in, and I was very surprised on my first day of class what it was, what it entailed. I think it's just being critical and kind of understanding the different moving parts to public health. I I understand, like, especially as a student, you want to take all your classes in the field of concentration you want it to be in. And I know, like, as an epi student, I had to take community health sciences, I had to take environmental science class, and you might not think those are really important, but different aspects of those other classes really do affect your real world situation. So you might think as an epidemiologist, all you're going to do is data analysis and statistical analysis. And that's really not the case. Like, at my job right now, I'm like, I'm managing, I'm doing like data analysis, I'm doing Tableau work. Somebody mentioned, Cynthia mentioned GIS. Some people have those skills. So it's very, it's really like multifaceted, and understanding the other parts of the concentrations you're not in is also very important when you're going into it. So just keeping an open mind is what I would suggest. Just soaking in all the information and kind of being very critical to what you're learning is important, because you might not think one aspect is going to be relevant, when you're in the workforce, but it might. And there are skills that I've taken from other classes that weren't epi-based that have really helped me in my job and my career going forward.
I would say, oh, go ahead, Cynthia.
It's all right. Go ahead.
I would say I would recommend to students to use this summer to really look at reading the newspaper. I encourage you to read daily. Also, I know this is going to sound a little strange, and you're probably saying this because I'm a professor. Articles, work on your critical thinking skills. That'll definitely help you. One other thing, too, that I would also suggest that you do is to sort of map out, what do you want to do in 2 years, what do you want to do in 5 years, what do you want to do in 10 years. You may not have the answers now, but just do some of those things. And then lastly, I would say is to find an appropriate coping mechanism. Graduate school can be a little challenging, and you want to make sure that you're able to have a school work-life balance. And so learning how to do those things, I think, would definitely be advantageous.
I would try, I think those are great suggestions from everyone. And I think just keeping in mind that you can map a career path, but it often shifts. And so being open to opportunity, and of course, when we are able to come back to campus, getting involved in activities here, the student groups, or in some kind of volunteer activity that relates to public health as resume builders, and just more of a chance to learn. I think there's lots and lots of opportunities that college has been developing. It's really its community engagement piece a lot in the last couple of years. And I also wanted to say that you shouldn't be afraid of your faculty members. And if you're trying to decide what to take, feel free to reach out to find out, even get a copy of the syllabus so that you can get a better idea of what's being taught. Obviously there's some structure, but you have flexibility. And also explore the other disciplines within public health that you may not be focusing on, because if you have a particular interest, you might find that there's a course in that area that you really want to take advantage of while you're still in the school. And maybe even beyond public health. I took courses in urban planning. I'm sure there's classes across the campus where you have that flexibility to consider, just how do you really mold yourself to have the skill set that you are interested in and you can be excited about.
I echo everything that everyone just said.
Great. Thank you all for that. So we're getting a lot of questions on both the applied practice experience and career. So I'm going to kind of take them in order. So let's go chronologically. So first, applied practice experience. For our alums, I think it was probably called either the internship or field practicum when you were there. CEEF keeps changing the names of all these things on it. So maybe if any of you can talk a little bit about your experience. How did you find your internship? Was it paid? What did you do? Those types of things.
So I did my internship in 1995. So that's a long time ago. And so it was not paid. And so how I found it was that I was working at the University of Illinois Perinatal Center. And so I was able to do it there. However, it was an additional 30 hours per week that I had to do outside of my current responsibility. So the vast majority of the learning experience is done through volunteerism. All of my classmates, and that was a long time ago, none of us got paid. And so we had to figure it out in the sense of balancing what our responsibilities are. Could we get loans to offset that? And so that's sort of what happened. I found my experience to be very interesting and very rewarding. One thing that I would say is that as soon as you get admitted to the university, as soon as you start your classes, start thinking of some places you would like to do your learning experience at. That's very helpful. As Cynthia said, please speak to your faculty. Feel free to speak to alums. Many alums are willing to take students on. The one thing that I would definitely recommend, if you haven't done already, is to make sure you have your resume and cover letter ready. Because an opportunity may come up, and I tell all of my students, have your resume and cover letter ready within 3 minutes, so that if you meet someone, you shake their hand, you could run and send them your resume and cover letter.
I can share a little bit. So obviously I've shared, of course, that I was in the dual program. And so my practicum was actually morphed into my full year social work internship, which were both unpaid. So I think it's a real privilege if you can find a paid opportunity, but no, there's like nothing wrong with an unpaid internship. In fact, we know that resources are extremely thin. And so those are the types of opportunities that are pretty hard to come by, I would say, for paid opportunities, but know that just because you're unpaid doesn't mean that you're not extremely valuable to an organization. So my practicum was very focused on the area of research that I was interested in, or area of work, which was youth violence prevention. So I worked at the YMCA in Chicago doing violence prevention work. But I will also say that sometimes you're really fortunate to get the most amazing internship, like your dream one. But if you get one that's like not aligned, or it's like, man, this one's like not exactly what I wanted, take it as a learning opportunity. That can help inform that this might be a place that you don't want to work, or these are the things that you don't want to do. So even if it's not like the dream position that you imagined, try to frame it in a way that what can you learn from this place? Like, is it that they're doing something of public health that you're not interested in? Is it the size of the organization, the work? Know that it may not be completely perfect at all times, but try to find the learning that you can, and just the extent to which that you can make it taking your coursework and applying it there. So like, hey, we learned about this theory or this common challenge in my class. Like, how am I seeing this at this place? So just constantly being critical of how this applies from the course to your practicum. But again, yeah, not much changed from when I was in school to having no paid internships.
For myself, I worked mine was unpaid as well. I know a few people who got lucky and got some paid ones, but that's really, really rare. Um, my year was kind of a strange one. We were all kind of struggling to get practicums that year. I don't know why. Maybe it was the economy. I have no idea. But I remember reaching out to Dr. Hershaw, who's the departmental head for epidemiology, and he was kind of like a sort of pseudo mentor to me at that time. And he actually has a lot of context. So reaching out to your professors and people who are working in your areas of interest is also a really good idea. He's over infectious diseases, and that was my interest when I was in epidemiology. So he connected me with somebody at Northwestern, and I worked at their infection prevention center at the Northwestern Hospital. It was completely unpaid, but it was such a rewarding experience because that area of public health is actually relatively small. It's extremely small, and usually a lot of clinical individuals like nurses who decide to stop practicing end up going into infection prevention. So it was a very rewarding experience working with a lot of clinical people in Northwestern as well. So that was kind of my experience of how I got that internship. So reach out to your professors. They have a lot of contacts in the field, and they know a lot of different people across the Chicagoland area and even outside. So they can help you if you have interest and if you want something specific. So
Great. Yeah, and just so everyone knows, we do have just kind of the school's changed the model a little bit for the applied practice experience. Now we do have Michelle in our office of student affairs. She's a really great resource if you have questions on what's available, different roles. And then there are specific faculty practicum advisors within each department. So you'll have opportunities to help. We don't place, but we do have resources there to help you with it, which kind of leads into the career questions. We also have a career services office. Laura Roman's our assistant director for career services. She's a fabulous contact if you have questions about that. George's point about having a resume and cover letter ready is a really great one. We really encourage you in your first semester to start talking with Laura and thinking about those things, because if you're an MPH in 2 years, it goes really fast and all of a sudden you're kind of thrown out there. So let's jump into the career question. How did the school help you to find work after? How did you find the position you went into after graduation?
I can kind of jump in. I actually had a kind of a sucky experience in the sense of employment after grad school. Like I said, practicums were really difficult to get when we were in school. That kind of bled into our employment status as well. A lot of my colleagues were unemployed. It's a lot different now. Public health has grown massively in the last 5 years across Chicago. It was relatively small when I graduated, especially in epidemiology, and everything was competitive. So again, it was connecting back with the school. It's funny that Brandon brings up the career services. I actually, the previous person, Liz Herrera, I contacted her to help me set up my resume and see what I could do better. And I connected with her, but I also connected with my professors at the school, and they kind of let me know any positions and situations that were coming from their end, because they do have a lot more contacts, and not every job is posted on the one job site that you're looking at, and they have more of an insider look at those types of things. So connecting with them helped me kind of streamline my process of getting a job right after I graduated. It wasn't quick. It took a few months. Like, I think I got my job, graduated in May. I ended up interviewing for the job that I ended up getting in November, but we decided to only start that January. So it was about like 5 or 6 months. You won't have that problem. Public health is huge now, but just staying connected to people and the career services department, that will really help.
I'm happy to jump in, and this also answers a question that someone asked about pursuing research during your graduate education, and so I can talk to my specific experience about that. Absolutely, doing research or graduate assistantships during my graduate education very much fed right into my ability to find and get employment after graduation. So one, it was great when I was in school to have an RA-ship because it helped pay tuition. And two, it helps build your resume while you're in school. And so I was fortunate that I had a paid RA-ship, but you can also reach out to faculty and ask if they have opportunities for you to volunteer to support their work. So to echo what George said about having your resume ready, try to do what you can to volunteer in the community or do research on the side to help your resume kind of build while you're in school. And that also starts getting you connected to folks as graduation is on the horizon. I think it's much easier, I think, to get a job when you have a relationship with someone. Relationships are central to the work that we do. So, reaching out to people and you also have the amazing luxury as a student of people just having so much more grace with you. Like if you say, hey, I'm a student at the School of Public Health, I just would love to do an informational interview with you. People love talking about themselves. So reach out to people and ask them about their job, what they do, what you're excited about it. And then just say, thanks for your time. And then maybe if they have a job opening, in a year when you graduate, it could lead to something. So I would say, yes, of course, use the resources at the school, but reach out to people who have that dream job that you might want to have and just ask them to tell you about it. Again, people love talking about themselves. So just reach out to them, ask to learn more about the work and how they got into it. I think those are some of the nuggets of advice that helped me, at least when I graduated.
Yeah, I think those are great. And I would add that there's got to be huge amounts of opportunity for volunteers now in the current crisis and coming forward. So faculty are being asked for advice all the time. And also there's so much data that I think that, they'll probably have huge amounts of ideas, on the research side that they'll want students to just engage and, do projects. Or if you have an idea of an area you're particularly interested in, you may want to approach some faculty that seem to be working in that area as well and say, I have this idea to explore. Would you consider even advising me on that? So I did switch to a research direction because I have the PhD as opposed to the DRPH, and I was assigned an advisor who was associated with the School of Public Health, but also another center on campus, the Institute for Environmental Science and Policy, to work with me, in that direction. So, obviously if it turns out that research is really your thing, you may, want to make sure that MPH is what you're doing. But I've also worked with students from public health. MPH students have come to our office and done their internship with us, unpaid usually, and helped us out with, data collection or program development. So certainly if that's of interest to you, if you have an environmental interest and particularly around sustainability and prevention, behavior change applies to the work I do just the same way as public health. So feel welcome to come and, contact our office when you come to campus.
Great. Georgia, do you have anything to add to that?
The only thing that I would say is just be ready, and don't wait till April of your last semester. Start as soon as you as soon as classes start. Again, there is no such thing as a perfect plan, but at least have a plan.
Great advice. Thanks, George. So with that, I'm going to jump to a question down a little bit about, someone asked about the global health concentration. I'm not sure if any of you were in that, but that's for everyone on the call. Global health is one of the, probably our largest subconcentration that you can do with any of the MPH degrees. Did any of you have a global health concentration?
No, when I'm really dating myself. So I did take a global health class, and during my experience, when I was getting my MPH, global health was evolving. So there were opportunities, but not as many opportunities that are available now for students.
Yeah, I didn't do it, but a really close friend of mine did, and she did her internship in Botswana and really loved it. So she really loved the faculty who were in the global health program. I didn't do it, but to Brandon's point, it was extremely popular when I was in school, and I graduated in 2016, so relatively recently.
Same with me. I wasn't in it, but I had a lot of friends who actually did it, and one of my friends did hers in Kenya. And there's a whole group that's concentrating on just global health. So if that's your interest, you should really look into that when you join. But also there's multiple professors who constantly go on trips every like summer to do their research in like different countries. Like, and there's so many opportunities for students if they're interested in that. I know one of my friends, she did Kenya and she did Haiti when we were in grad school. So there's a lot of opportunities throughout your MPH to get involved in global health.
Yeah, definitely. And it is, a lot of our students do them abroad, as you heard just from that. And Chelsea Peters is our assistant director for the global health program. So if you reach out to me after, I'm happy to get you in touch with her if you have more questions on global health concentration opportunities or want to talk to one of our current students who are in that program now. They'd all be happy to help. Got a few questions on research. So I guess kind of how would you recommend getting involved in research? Did any of you have like a research assistantship or anything like that? If you can talk a little bit about research opportunities in the school.
When I was while I was getting my degree, I was fortunate to have a research opportunity. So I worked at the UIC Perinatal Center, which today has really piqued my interest or continued my interest in maternal child health, more specifically infant mortality among African American women in preterm labor. If someone's interested, well, let me say this. If you're in public health, you're interested in research. So I'm just going to say it. What I would say is that take as many research classes as you possibly can. As Emily said, it could be qualitative, quantitative. You'll learn that in your research class, but also just come with an open mind. Research is sort of like a process. It's not like, it's like riding a bike. When you were 6, you just didn't get on the bike without training wheels and just roll 12 miles. You didn't. So it's the same thing in regards to research. You would have to learn, what is your area of interest. As stated, there's qualitative and then there's quantitative. There are very few people who master both. And so you just have to learn what you're good at and what your interest is. But again, as all of my colleagues have been saying, is that speak to the faculty who do research. Just ask them questions, send them emails, and then also when you're in your research method class, just at that time, start talking with who's ever teaching that class, the professor, to see if he or she can direct you to some people who may be of interest to you. And if all else fails, just start going to the UIC School of Public Health website, look at the faculty CVs online, and you can start seeing what faculty do what particular research. So that is a way too. And start reaching out to them. I can say that the faculty at UIC is very student friendly. As Brandon stated, we have staff that are there to help students. And so what I found out is that students who have been proactive have a great experience.
Yeah, I'm happy to echo that. Similarly, I was also really fortunate to get what started as a graduate assistantship, which then turned into a research assistantship for the whole time that I was in school. I worked on 2 separate projects, one at the School of Public Health and one at Jane Addams. And similarly, find faculty that have research interests that are like yours, right? If someone has a really cool project related, for me, it was connected to the juvenile justice system and then of course violence prevention, but you could be really interested in nutrition or housing. And so yes, of course, reaching out to faculty and just finding out what cool projects that they have going on. Maybe you don't, in fact, you probably won't write your first manuscript, the first project that you do, but you might help them with like a literature review because that takes a really long time. And it would be really nice if a student helped a faculty find some relevant research articles. And so I would echo everything that was just shared. And then also don't limit yourself to just the School of Public Health. UIC is an incredibly dynamic institution and there's amazing work happening in the College of Ed, in the College of Medicine. There's like so many cool things happening. And so if you don't find a faculty that's like crystallized, perfectly aligned with what you're interested in, look beyond the walls of the School of Public Health, see what else is happening and what you could tap into, and know that you may not like get your first publication right out of your first opportunity, but you could help with something. You could help doing some coding or something like that. So just reaching out to people never hurts. Again, it goes back to the same thing of like people like to share about what they're doing, and it's completely okay if someone has a small opportunity that you could help with, and that can help lead to something bigger down the line.
Yeah, really echoing Emily, like what I think a lot of people forget is there's so many different schools in UIC. And for example, my sister right now is a PhD in epidemiology at the School of Public Health, and she's doing her she's working at the College of Pharmacy. I know many people who worked also with the Chicago Department of Public Health. Just keep your eyes open for opportunities, connect with people, network with people, but also pay attention to SPH has a really good system where they have SPH views. And if you subscribe to that, they're constantly, like, I'm still connected to that. And I constantly see emails for people wanting graduate assistants, research assistants. So there's always opportunities out there. So just be proactive, like, people are saying, so that will help.
Cindy, did you have anything to add to that?
I think it's pretty much been covered.
Okay. So with that, we're kind of winding down. So I'm gonna kick one final question out to you, put you all on the spot here. Do you have one kind of most memorable or impactful experience? Was that a specific course, specific faculty member, just some sort of experience that really sticks with you even after graduation?
I guess my most memorable experience was when I had gotten a phone call from Dr. Shafdina Muo. He called me one day and was like, he's from Nigeria and has a very thick Yoruba accent, and he told me that I was going to be involved with the UIC Alumni Association. And so he was my advisor and my mentee, and I really couldn't say no. And so he was like, George, I need for you to do this for me. And so I joined as the treasurer, and then I became the vice president of the Alumni Association, then became the president of the Alumni Association. So I guess that would be my most memorable experience is when you reach out to faculty, they will ask you things too.
Yeah, I'm happy to jump in on that. So connected to reaching out to faculty, we'll have two that stand out. One, like I've mentioned quite a lot, I had a really amazing, extremely dynamic research assistantship at Cure Violence, which I had an opportunity through some extra funding that we had left over to travel with some of my colleagues. So it was centralized in Chicago, but I had an opportunity to go to New York City and Baltimore and Philadelphia and work with the sites there. So it was really great to have some travel opportunities through my internship or my research assistantship. But in regards to faculty, some colleagues and I from the School of Public Health actually for 2 years had an intramural basketball team. We were terrible, but it was actually like so fun because you forget that you're like still a student and doing fun stuff. And so actually Saria Adewala, who is a biostatistics professor, was on our team and it was so fun. So he was on our basketball team and we would play against these undergrads who took it like so freaking seriously, but it was like so amazing. So that was a really fun experience. He was on our team for 2 years, so.
That sounds on brand for him.
Yeah.
I wouldn't say I have a particular memory that's most memorable, but I would say just my experience with the faculty has been amazing at School of Public Health. I'm still connected to Dr. Harshal. Like I'm constantly in contact with him. I actually joined it's not called this anymore, but it was called the Recent Graduate Board a few years ago. And that was kind of like a bridge between the alumni board and recent grads, and they want to kind of bridge the gap between that, and now it's become the Alumni Council. So that's actually how I got connected to this event today, is that Emily, she actually connected me to Brandon asking for volunteers to do this, to talk to you guys. So I would say that that's been my most cherished experience, is being connected with the faculty, but also being able to give back to the school for my experiences and things that I've learned from my career path and journey. Like I've been able to connect with so many other professors after I graduated and through events and alumni, but I've also been able to connect with recent students and see how their experiences have changed and helping them with their career journeys as well. So it's been really rewarding in that sense for me.
I guess I would say that it's, my experience was as a working student. I was working full time at the same time. So I didn't really have the chance to take as much advantage of the peer, because it was 7 years. People came and went in that time. definitely connecting with the faculty. And of course, I get to continue to work with them in different ways, whether it's to come make presentations or to actually do some research together. And I continue to see how committed they are. I guess I would just say that, you know, it doesn't matter what kind of student you are, whether you are full-time in this or you're taking your time to get through it. There's a place for you in the organization, and, you know, to be as engaged as you can in whatever way, whether it's just your classes and, you know, the required pieces or anything above it will be a big experience. I think one of the most memorable things I had was actually at my graduation, being in line and seeing that there was another person who worked in my same unit in the university that I had no idea was completing his PhD at the same time. So, you know, it was like, how did we never run across each other in all that time? So UIC is a big place, but it's also a small world. So there's opportunities there for everyone. And the other thing I guess I wanted to share was that I kind of had a point where I was like, this is too much. I hadn't done as well as I wanted to in a class. It was really challenging, and I stepped back. I think I was trying to do 2 courses a semester while working full time, and I stepped back and maybe even took a semester off and was just rethinking, you know, is this? And that's actually where the turn came towards sustainability and away from kind of safety. And so, you know, give yourself that, you know, leeway that if it isn't really what you hoped for, then try to figure out how you can make it work as you go along.
I think that's really great advice. Thank you. I think that's a good note to end on. Everyone, thank you so much to our students for joining us. Alums really appreciate your time. I do, the students do. Thank you so much for joining us. And everyone, if you have questions, always feel free to reach back out to me. I'm always happy to help.
Yes. Go Flames, go Flames. Love that sweatshirt, George.